Dr. John with NBC News here on this Facebook Live, where I cover coronavirus headlines and news over the last couple of days, get behind those headlines to give you a bit more information so you have an understanding of what that headline actually means, and also answer any questions you might have. So please forward your questions while I'm going over the headlines. We'll get to as many of those as we can. And I have to be honest with you, your questions are fantastic, and they're often things that myself or other experts don't think about. So it's great having those questions because it gets down to what people really want to know, which is what I'm trying to do. Get that information out that people really want to know that can really help them get on with their lives, stay safe, them, their family, their loved ones, and their communities. Let me go over a few headlines here. Number one, the numbers here. The numbers are going up, and as you've probably heard over the last couple of weeks, we're having outbreaks in certain states across the country. Here's the numbers. 4 million plus cases right now. So we've reached that 4 million case level. Unfortunately, out of that 4 million case level, there's 144,000 deaths also that we've noted. Hospitalizations are going up in certain areas. And this is in trend with what we thought would be happening. Now, we are seeing an increase in cases for a variety of reasons. Number one, we are testing more. So you are seeing more cases because of testing. But number two, we're also having more cases. And the way we notice that and the way we know that's happening is because the hospitalizations, which we typically say follow cases by a couple of weeks, are starting to go up as well. And so I think you're going to start seeing a spike in those hospitalizations over the next week or so. Unfortunately, deaths follow after that. The good news, the silver lining to this, if there is any good news, is that these deaths, these cases are not happening. These deaths are not happening as they were back in April. Part of the reason is because of who is actually getting the cases, typically young adults who don't tend to have the complications or problems that older adults do, which is what we were seeing back in April of this last year. One thing we are seeing, though, is some nursing home issues going on across the country. They're looking very hard at how to get that under control. Testing is a big issue there. We'll talk about it in a little bit. But again, it's one of those things that to get all this under control, the things we all know we need to do are important. Face masks, social distancing, small groups, a lot of hand washing. I know it's boring. I know we talk about it all the time, but it's extremely important and things we know that work. As a matter of fact, a study just came out saying of different things, social distancing, warm weather, rural regions, those types of situations, that social distancing was the most important thing you can do there. They didn't incorporate masks into this issue, but masks and social distancing are the biggest part of the equation right now that we can do. One thing to note, there are 18, as of a few days ago, what are called red zone states. Those 18 red zone states are states that are starting to get in trouble with increased cases of coronavirus. And by red zone states, there's a couple of criteria. One, they're starting to see over 100 cases per 100,000 people population. So it's per capita cases of 100 per 100,000. Once they start getting to that area, they're starting to look at them as red zone states. The other part of the criteria is that positivity rate of higher than 10%. And like I mentioned, one of the ways we know this, not just testing causing an increase in number, is because of the hospitalizations are going up, but so too is the positivity rate. And in some areas, this positivity rate is hovering around 20%, which is much, much higher than we want it. We definitely want it under 10%, and that's important to remember. And so again, some of the things to remember is this over 4 million cases, 144,000 deaths. And one thing, looking at comparisons, I've often compared us to other countries and how they're doing. In other countries, particularly in Europe, there are some regions that are starting to see more spikes in cases. Those regions are starting to roll back their reopenings. But they have handled reopenings differently than we have, and the results seem to be better than we have here. Time will tell what's the most effective, but we do know, again, the four things that work the most: face masks, social distancing, small groups, and hand washing. That's what it's going to take to get this under control until we do get that vaccine and more treatments. So that's number one, the numbers out there. Number two, there's a study that came out talking about steroids. Dexamethasone is a steroid we've been looking at, and we think other steroids will work as well. Studies are looking at it to find out if other steroids can work as well, and they should, for this main reason. Steroids are potent anti-inflammatory agents, and what the steroids are doing is they're actually handling this cytokine storm, the inflammation that comes after a person has COVID-19 and they start to recover. Their body's immune system doesn't quite know how to handle the coronavirus, and so it goes into overdrive, causing this huge inflammatory reaction that can cause this cytokine storm. When that happens, the whole system gets overwhelmed, organs start to fail, and that's unfortunately where some of the deaths come from. So getting that under control is important. And we found out that dexamethasone, which became the first drug we had that actually cut down on deaths, other steroids should work equally as well. But one thing they're finding out is that giving it at the appropriate time is important. So if you remember with the hydroxychloroquine issue that happened a few months ago, there was a huge run on hydroxychloroquine. A lot of people were getting it to have in their house to use in case they started getting symptoms, or to use to prevent from getting those symptoms in the first place. Well, now we know hydroxychloroquine doesn't work for that. Same thing here with the steroids. You don't want to go out and start these on your own for one very particular reason. If you have mild to moderate illness, the steroids are actually going to make things worse. And here's the reason why. Steroids, in addition to being anti-inflammatory, tampen down the immune system a little bit. Because they tampen down that immune system, your body's not going to be able to fight off coronavirus, so it's going to take its toll on your body at a much quicker rate and cause much more severe complications. So again, mild to moderate illness, these steroids do not work. They make things worse. For more severe illness, especially people on ventilators and people on oxygen, then these steroids seems to work, but they need to be done at a very specific time frame in a very specific way. So again, this is not something for everybody to go out and get these steroids, which are ubiquitous. They've been using these steroids for decades, and they're very readily available. You don't want to use them unless you're in the hospital. So definitely let the hospital, let the doctors and nurses determine when to use them for you. Don't try and go and do this on your own. And again, as the saying goes, don't try this at home. The third thing is CDC guidelines. The CDC released last week guidelines on what to do if you have coronavirus and when you can be released from isolation. Well, if you have coronavirus, either because you have symptoms and you were in contact with somebody, or you test positive for coronavirus, up until now, it's been around 14 days at home, either test negative twice, stay home for 14 days, fever-free for 3 days. There's a variety of different guidelines. Well, the newest guidelines they put out have changed a little bit. And here's what they're saying. If you have coronavirus, duration of symptoms need to be 10 days. You need to be 24 hours fever-free. So once you've passed that 10-day period, and in that 10-day period at the end, you're 24 hours fever-free without any medication to bring your fevers down, then you're free to leave isolation. At that point, you're no longer considered contagious. That is if you have mild to moderate illness. If you have more severe illness, they say it's more towards the 20-day mark, and that's something you and your doctor are going to have to try and figure out depending on the severity of your illness. But just to make sure we have an understanding on this, this is the CDC site. For most persons with COVID-19 illness, isolations and precautions can generally be discontinued 10 days after symptom onset and resolution of fever for at least 24 hours. But then they go on to say, too, one big thing is if you get tested for coronavirus, or if you think you had coronavirus and you recover from coronavirus, do not get another coronavirus test for 3 months. The reason they're saying that is because it could detect coronavirus particles in your body that you might have, but it doesn't mean you have coronavirus, but it's going to show a positive test, and that's just going to add a lot of confusion and a lot of stress to you and your life. So again, what they're saying is if you do have coronavirus, you recover from it, do not get tested for 3 months. What they're saying is retesting, this is their quote, retesting is not recommended within 3 months after the date of onset for the initial COVID-19 infection. So there. So again, it's down to 10 days, 24 hours fever-free. If you have mild to moderate illness, that's when you can go ahead and go out and about. If you have more severe illness, then you want to make sure that you go 20 days, somewhere in that time period at least, and definitely talk with your doctor about when's a good time to go out and about. So hopefully this helps out a little bit. But again, just to kind of recap the stories I'm talking about, number one, the numbers, 4 million cases, 144,000 deaths. 18 states are considered in the red zone, which means that they're getting into trouble with numbers of cases. So we need to make sure we get that under control. Number two, steroids. Dexamethasone is a steroid that's been studied. No reason other steroids won't work, but the main point here is don't take these on your own because they can make things worse if they're not given at the appropriate time. They should only be given for people who are severely ill with coronavirus, not mild to moderate illness. And number three, the quarantine, the isolation requirements now, 10 days of isolation, 24 hours fever-free after onset of symptoms, and then you're okay to go out and about. The CDC no longer considers you contagious. So let's see if you have any questions.
We were talking about the CDC saying 24 hours fever-free, but they're also saying that only 20% of cases have fever. What do we do?
So that's a great question. They're saying that only 24 hours, that basically the CDC is saying 24 hours fever-free, but at the same time they're saying that a majority of cases, or some cases, don't have fevers. That's not always a symptom for everybody. So why the confusion there? And I can understand how that can be a little bit confusing. So if you've gone 10 days with symptoms and have absolutely no fever in the 10-day time period, then you're okay to go. Because they say at that point, even though symptoms might linger a little bit, that you're no longer contagious. But if you did have a fever, you need to make sure you're fever-free for 24 hours. It used to be 72 hours. They've pulled that back now to 24 hours. And so again, regardless, you need to be fever-free for 24 hours. If you never had a fever, you're certainly in that category. If you did have a fever, you have to wait until you're fever-free for 24 hours. But I can understand how that can be confusing because not everybody has all the symptoms. What we know of as classic symptoms are the fever, the cough, kind of the tightness in the chest and the shortness of breath. And there's ancillary symptoms as well. The lack of smell, lack of taste, abdominal pain, headaches, neurological symptoms. The list goes on and on. It's a new virus. We're finding out a lot about it. But again, 10 days, fever-free for 24 hours, whether you had a fever or not, then you're free to go.
So is that including what if you're tested positive but you don't have any symptoms?
So and that's a great question. I did not bring that up. For people who never develop symptoms, if you test positive, then what the CDC says, from the date of that first positive test, wait 10 days. So again, it's 10 days fever-free, but if you never had symptoms, you're fever-free to begin with. And so 10 days from that first test you have. So thank you for asking that question because that's one part I forgot to put in there. So if you tested positive, from that first test positivity, 10 days, then you're free to go, as long as you don't develop symptoms.
When should I take an antibody test after testing positive?
So the question is, when should I take an antibody test after testing positive? Now, the antibody tests, it takes a while for your system to develop antibodies, particularly antibodies they're looking for. Your system develops antibodies in a couple different ways. Number one, there's the IgM. Those are the initial antibodies that your system, your body uses to fight off coronavirus. And this is essentially like a big army that comes in and just uses blunt force to get rid of the virus. It's very nonspecific, tries to get rid of any kind of infection or foreign agents in the body and gets them out of there. Over a couple weeks, your body develops what are called IgG antibodies. Those IgG antibodies are more specific for coronavirus, and that's what we're looking for in the antibody tests, those neutralizing antibodies, the ones that are specific. So it takes 2 to 4 weeks to develop those antibodies. So the recommendation is, if you recover from coronavirus, you want to wait 2 to 4 weeks after recovery to take an antibody test because it might be negative because your body hasn't quite developed those yet, but over the next couple of weeks it could develop positive. So again, 2 to 4 weeks, you want to wait that time period before you take an antibody test to get good results.
They are now saying antibodies to COVID go away after a few months. Does that mean we can get it a few months later again?
So the question is, they're now saying that antibodies to COVID-19 go away after a couple months. And the reason they're saying that is because they're noticing decreased numbers of antibodies in people they've been testing over time. If you think about it, we've had people who have had coronavirus since late January, early February timeframe. And so we have more months of people who have had coronavirus to study. What they're finding out is people that had them early on initially had large amounts of antibodies. Those antibodies are decreasing over time, particularly if they had more mild symptoms. It looks like they're going away. What we don't know is what exactly that means, and that's because of the way our immune system works. And just to give you a little science behind it. So again, like I talked about, your immune system develops this IgM antibodies to help get rid of the virus. Then it develops the IgG antibodies to neutralize that virus if it comes back in the body. Those are specific. It also develops, while it's developing at the same time, these things called T cells. In particular, one called a helper T cell. Those helper T cells are like sentinel cells in the body. And what they do is they stay forever, or for at least a long period of time, in your bloodstream, in your body, constantly looking for this specific virus. If they find this virus, then they induce the immune system to develop antibodies to fight it off. And what we don't know is if your antibody level has started to drop, but you still have these T cells, these helper T cells out there, how quickly can it generate those antibodies to fight off the virus? Can it do it fast enough? The example I'll give you, measles. If you've ever had a measles titer, what you'll find out is if your titer is good, well, then you're good. You're protected from measles. If your titer is non-detectable, as they call it, then that doesn't mean that you're not protected from measles. That simply means that you don't have antibodies at that point from measles. But one thing we know about measles is if the measles virus gets into your body, boom, your body, those helper T cells immediately induce your immune system to develop antibodies, and it can. That's why if you've had the MMR vaccines, even if you have undetectable levels, you're still okay. In the healthcare environment, we often have to check these titers to make sure we're okay. They'll look for these titers. If they're high enough, they say you're fine. If they're low, then what they say, or undetectable, they say, okay, show us your vaccination record. If you've had the proper vaccinations, then you're still okay, because we know those helper T cells will come into play to help you develop the antibody to fight off the virus. We think that's what's happening here with coronavirus as well. That even though the antibodies are dropping, these helper T cells will stay there, will start looking for the virus. If they find it, they'll cause the antibodies to be produced, which can fight off the virus. The reason I keep saying we think is because this virus hasn't really been along long enough to test that theory, but that certainly is the ongoing working theory right now. So even if your antibodies start declining over time, you should be protected. What we don't know is how long you're protected for, and whether those helper T cells are going to work as effectively as we'd like them to work. And that's why we say, even if you have antibodies, even if you have a good antibody test and you recover from COVID-19, you still need to wear a mask, because we want to make sure that everybody gets protected, and they're protected for you just in case this theory doesn't pan out like we think it will.
I'm positive for COVID. Can I go on a bike ride?
So the question is, I'm positive for COVID, can I go on a bike ride? The answer is no. You can't go on a bike ride unless you fall outside that 10-day period. Again, remember, if you're positive for COVID, you have no symptoms, you have to wait 10 days, and then you can leave isolation. Then you can certainly go on a bike ride. If, on the other hand, you have COVID symptoms, 10 days after you start those symptoms, as long as you're fever-free for 24 hours, then you can leave isolation and go on a bike ride. Explain a couple of things here. Quarantine versus isolation. Quarantine means that you are exposed to coronavirus, but you don't have any symptoms. You're not testing positive yet. There's no indication that you have coronavirus, but we need to make sure. So you're in quarantine for 14 days because that's the incubation period. That's quarantine. Isolation, on the other hand, is if you either think you have coronavirus because of symptoms, as in you were exposed, you start developing symptoms, or you test positive for coronavirus. Then you need to go into isolation for 10 days. Isolation means you can't be around anybody without proper equipment on. Preferably you're in a room by yourself, in a section of your house by yourself, and somebody is bringing food to your door, you're opening the door, they're masked up, you're masked up, everybody's doing the right things to keep your housemates safe, your loved ones safe as well while they're taking care of you. Isolation means that you have to stay isolated. You cannot go on a bike ride. Once you're free from isolation, you get outside that time period we were talking about, then you're free to go on a bike ride. But again, even on a bike ride, remember, social distancing is extremely important.
Can you explain what contact tracing is and why aren't we doing more about that?
So the question is, can I explain what contact tracing is and why we're not doing more about that? So contact tracing basically means if somebody comes down with coronavirus, and this is going to come into play when we start getting kids back to school in particular. If somebody comes down with coronavirus, they test positive, then what they do is they start talking to that person. Where were you? Where did you go? Who were you around? And let's say you went to a party with 8 friends. Well, what they'll do then is they'll call those friends. How are you feeling? You need to quarantine yourself for 14 days and keep a daily log of your symptoms. If you develop symptoms, let us know so we can test you, because then we might need to isolate you if you're positive. So contact tracing basically takes the person who is infected and looks at all their contacts and looks at their contacts to make sure they're quarantined for 14 days. If they develop symptoms, then they're isolated at that point. And then they contact trace beyond them at who might they have been in contact with. As you can see, this is a very difficult proposition, a very difficult thing to pull off, especially in a country of 350 million people. It's very hard to pull off in this country, especially the fact that people are very mobile and moving around. That's why social distancing is so important. One of the other issues behind contact tracing is it only works if you get fast test results. If you get test results, and unfortunately right now we're having testing issues, and sometimes test results are taking up to a week to get back. So you can imagine if somebody tests today and they don't get the results back for a week, and they're out and about doing things, all those people they're coming in contact with will have to be contact traced, and possibly people they came in contact with. So this can be very difficult. So to make contact tracing work, we have to get this testing under control. Then we can get contact tracing under control, and then we can get everything under control. In the meanwhile, since all this is still in the works, and it will get ironed out at some point, it's just we don't know when that some point will be, the things you can do to stay safe and make it easier, make this pandemic more likely to go away sooner. Those 4 boring things I always talk about: face masks, social distancing, that's 6 feet, small groups, most recommendations are 10 or less, meet outside instead of inside, much easier that way, and the virus is less likely to spread. And then a lot of hand washing, especially before you touch your face. Even though we know that contact surfaces aren't a great way to spread it, there's still a way you can spread it, and so you need to be careful there. So again, great question on contact tracing. That's one of the reasons you're not seeing it quite as much, quite as robustly as most health officials would like. We are getting there with it, but remember again, this has been 6 months. So we're making strides, not very quickly as some people would like, but we are getting there. So again, you do your part, health experts do their part, we all do our part, and we can get this under control. So thank you for your questions, wonderful questions as usual. Let me go over the headlines for today. We talked about number one, the numbers, over 4 million cases, 144,000 deaths. Part of that has to do with the numbers of tests that are going up, more testing, more people, but at the same time we're getting increased hospitalizations, increased positivity rates, which show it's more than just the tests themselves. Number two, steroids. Dexamethasone, other steroids work for coronavirus, seem to work for coronavirus as far as reducing the death rate. They will not work if you only have mild to moderate symptoms. As a matter of fact, they can make things worse because they can dampen down your immune system and make it less likely to work against coronavirus. So you want to be very, very careful with steroids. Let the professionals handle that. And then number three, the CDC guidelines. Again, 10 days is now the guideline, 24 hours fever-free in isolation. If you either have coronavirus or if you test positive for coronavirus with no symptoms, it's 10 days after that first positive test. Then you can go ahead and go out and about. Then you can go on your bicycle ride. So again, thank you very much for listening to this. I hope you have a fabulous rest of the week and upcoming weekend as well. And as I always say, most importantly, for you, yourself, your loved ones, and your community, stay happy, stay healthy.